Okay, so before we get started, I just wanted to double check. Can someone please go in the chat, and anyone, and just say if you can hear me clearly in the chat bar? Awesome. Thank you, Brandon. So good afternoon and welcome to this webinar entitled Connecting the Dots for Joint Health and Safety Committees and Health and Safety Reps in the sector of municipal libraries, inside and outside workers. My name is Felicia Forbes, the CUPE National Health and Safety Representative, and I'm also joined by our other National Health and Safety Representative, Paul Sylvester. A reminder that the presentation will be recorded and posted on the CUPE Ontario COVID-19 website. If you have any questions, please post in the chat bar, and we will try our best to answer as many questions as we possibly can before our 90 minutes is up. Please ensure that your questions are of a general nature and not a workplace-specific issue. As mentioned, the theme of our webinar is connecting the dots. And although COVID-19 pandemic has had a profound impact on our workers, it's important to remember that the law and principles of health and safety remain the same. The presentation today will serve as a reminder of what minimum standards in the Health and Safety Act and how to ensure the workplace is implementing measures that will protect workers from exposure to COVID-19. So with that, we're going to be moving to what the workshop will cover. So in this webinar, I will be discussing the internal responsibility system, duties of an employer, a supervisor, a worker under the Occupational Health and Safety Act, powers and duties of the Joint Health and Safety Committee, due diligence and incorporating the general duty clause in there and looking at the precautionary principle and how it all intertwines, hierarchies of control, and COVID-19 as a hazard in the workplace. So now I'm going to turn it over to Paul, and he's going to review the internal responsibility system.
Thanks, Felicia, and good afternoon, everyone. The internal responsibility system is a philosophy on which the Occupational Health and Safety Act is born. And this system must be in place to ensure that workers and employers are meeting the objectives of ensuring that the workplace is safe and secure for all those who work inside. So this is what the internal responsibility system looks like. It's workers and employers who are they have a shared responsibility to ensure that workplace conditions, that the hazards are identified and that they are remedied to ensure that they do not impact workers. Now, while this is a shared responsibility, we're going to find out later that it's not an equal responsibility in the sense that employers share the bulk of the responsibility when it comes to ensuring a health and safety workplace. But the workers do have certain responsibilities and certain duties under the Act, but also that the workers also have the right to participate. And despite all the changes that, as Felicia has mentioned, despite all the changes that COVID-19 have caused to our workplaces, the principles around the internal responsibility system should be maintained to ensure that going forward, that workers and employers are meeting their objectives under the internal responsibility system. At any time, either workers or employers can access the Ministry of Labor, who is responsible for enforcement of the Act. Now, for the internal responsibility system to be effective, employers, supervisors, workers, and other workplace parties need to have practical knowledge, training, and skills to control workplace hazards. And we're going to get into a little bit of what hazard control looks like. And when we say not manage hazards, what we mean is that we want hazards to be either eliminated or adequately controlled, and we don't want to manage the hazards, which just means the hazards stay in place and workers just work around the hazards and try not to get injured or ill. A component of the internal responsibility system is a functioning committee that is identifying hazards and making recommendations to improve workplace conditions with the goal of preventing accidents and illnesses and lost time injuries. And here's why we wanted to have this webinar, is because we want to address you as members of a committee to ask yourself the basic question: is the IRS working in your workplace? Do you have a functioning committee that is identifying hazards and making recommendations to improve the workplace conditions? Because that is what the internal responsibility system is founded on. Now, if any of the workplace parties is not fulfilling their duty, then the IRS is not working. I'm going to turn it over to Felicia now, who is going to be reviewing some of the Occupational Health and Safety Act, the duties of persons under the Act. And attached with your the email about today's webinar, we included 2 sheets which outline what is the employer's responsibility in terms of the Joint Health and Safety Committee. What are they supposed to do, or what are they supposed to provide to the committee? And also, what are the included also is another sheet that speaks to the rights and the powers and functions of a Joint Health and Safety Committee. But right now, we're just going to look at the duties of certain persons under the Act.
Thanks, Paul. So we're going to start with the duties of the employers under the Act. And under the Occupational Health and Safety Act, you can find this under Section 25 and 26. For the purposes of today, we're going to review and highlight clauses in the Act that we find are very important overall and for today dealing with hazards of COVID. So the employer has to ensure that the prescribed protective equipment, materials, and devices are provided and in good condition and used in the workplace. For the purposes of the sector that you folks are in, you would fall under the industrial regulations, and under there would have some reference on certain types of prescribed protective equipment, materials, and devices. The employer has to ensure that the measures, procedures, and training as prescribed are carried out in the workplace. So not only that there are procedures and measures and training that is done, but that it's actually being carried out and followed through in the workplace in a safe and effective way. Providing training and information about the hazards of the work, right? Making sure that the workers that are doing the work and dealing with those hazards, one of being COVID, are familiar with understanding what does that come with, and providing training on what to do in order to keep the workers safe while doing their job. Appointing supervisors who are familiar with the work, aware of the hazards in the workplace, and familiar with the Act, right? A worker should be able to go to their supervisor and be able to rely on them to provide them with direction, information, and training as well, and be familiar with the hazards in the work, because they're supposed to be supervising you and affording that assistance to you. Prepare written policies and occupational health and safety policies, violence in the workplace, and hazards, and developing programs to implement those policies. So making sure that it is clear, there's a clear protocol, but not only that these programs are actually being rolled out within the workplace and fully developed and implemented by the employer and the supervisor. Affording assistance and cooperation to health and safety representatives or committees in carrying out their duties and rights under the Act. And that's very important for you folks to note. And provide health and safety representatives or committees the results of reports respecting occupational health and safety that is in the employer's possession. So I know for not all of you, but a good chunk of you have not been working. So this would be very useful when you folks are returning back to work to see what type of reports the employers obtained. Have they done any reporting in terms of seeing what the condition of the workplace looks like? If they have PPE supplies, what does that look like? So that would be good for you folks to be able to tap into and look at various reports that are related to health and safety that you folks will be able to take and analyze and use in order to make recommendations and follow through with that. Notice of accidents, incidents, and workplace violence, and occupational illnesses. So a written notice is provided to the health and safety representatives or the health and safety committee, whichever you have in your workplace, and the union in the event of an accident, incident of workplace violence that requires medical attention or disables a worker from their usual work, and a worker who has suffered an occupational illness or has filed a claim of occupational illness with WSIB. And this written notice is provided within 4 days of the occurrence. So this is really an important tool that we want to really highlight for you folks to utilize, and you would have seen memos and probably suggestions from your staff reps to make sure if you are currently working or going to be going back into the workplace and you are exposed to COVID, then you should be filling out toxic exposure forms, and also filling out, if you do become ill, filling out an occupational illness form, a Form 6 with WSIB, and that would trigger the employer's obligation to then provide written notice to the committees 4 days short after the occurrence. Duties of the supervisor. So again, we're not going to go through all of the duties of the supervisor under the Act, but this can be found under Section 27. And ones that we want to highlight for you folks today is that they have to work in compliance with the Act and the regulations. They have to ensure that workers wear any protective equipment required by the employer to be worn, ensure that measures and procedures that are established by the employer or by regulations are carried out in the workplace, and acquaint workers with hazards in the workplace to which they are aware of. And then we're going to talk about the duties of the workers. So you can find this under Section 28 of the Act. You folks too have to work in compliance with the Act and the regulation. You have to use or wear equipment, protective devices, or clothing that the employer requires to be used or worn. And we just want to note that workers do have to wear and use materials and equipment and PPE that the employer does prescribe to you, but making sure that it's not causing another hazard and it's in good condition and safe to be worn or used. Report to their supervisor the absence of any protective device or equipment or contravening of the Act that is likely to endanger workers. So if you see that there's something that's not working the way it should or is missing to do your job, then you need to advise the employer and the supervisors of such, and not to remove or make any ineffective or protective device or operate any equipment, device, or machinery that may endanger themselves or another worker. So if you know that there's a piece of equipment or PPE that is damaged, for example, then you should not operate or remove it you should not operate it and use it, which then would endanger yourself or another worker, and it should be reported immediately as the third point that I made there. So now I'm going to turn it over back to Paul, and he's going to review what are the powers and the rights that you folks have under the Occupational Health and Safety Act, and how can you use those powers, rights, and functions in order to do the very important work in this very important time.
Thanks, Felicia. So we've learned the duties of certain persons under the Act, and that is one piece that we should help take forward when just remembering that COVID-19 it doesn't absolve the employer from ensuring that they have that make sure that they're complying with their duties, and that supervisors also are complying with their duties as well. So when it comes to you as Joint Health and Safety Committee members or health and safety representatives, we just want to review to remember what are our powers, rights, and functions as members. So we have to first understand the distinction between what is a health and safety representative and a member of the Joint Health and Safety Committee. So a health and safety representative is required at a workplace where between 5 and 19 workers are regularly employed. And you can find that in Section 8 of the Act. And the Joint Health and Safety Committee is required at workplaces where 20 or more workers are regularly employed, and you'd find that in Section 9 of the Act. Now, the difference between both the Health and Safety Representative and the Joint Health and Safety Committee is they have similar powers and functions under the Act, except for meetings. if you are a health and safety representative, you don't meet with the employer, but you still maintain the power and the function to identify hazards and to make recommendations and obtain information about those hazards. So essentially the roles of a Joint Health and Safety Committee are, in the general principles, are to identify situations or conditions that are hazard to workers, obtain information from an employer concerning hazards, processes, and equipment, and making recommendations to improve workplace conditions. And going forward, when Felicia mentioned earlier that some of you perhaps have not been to work, and when you return to work, it is essential that the Joint Health and Safety Committee have a say in any kind of plans of workers returning to work. It's not as if workers just come to work and all of a sudden they have to start working in this new era of COVID. Well, no, there has to be some measures in place that are analyzed by the Joint Health and Safety Committee for them to look at what is the plan and what can we take out of the plan. Is there any gaps within the plan that should be noted? And can the committee look at that plan and study it and to provide recommendations to improve that plan so that when workers do return to the workplace, that everything is set up in such a way that they're informed and they know what to do as soon as they start from day one. So we're going to talk slightly about multi-site committees and single-site committees because municipal, you might have either situation. We're just going to touch on this briefly. So where so permitted, a multi-site committee may be established, and that is with approval from the Ministry of Labor. And in this case, one committee can be established for several workplaces under the same employer or municipality, and instead of a single committee at each site. Multi-site committee members have the same rights and duties of a regular Joint Health and Safety Committee, except for multi-site, if you have one, there has to be terms of reference which must be signed by both parties and approved by the Ministry of Labor. And you have to ensure that your terms of reference are up to date. And when amendments are made to the terms of reference, they have to be sent to the director of the Ministry of Labor for them to approve them. Now, if you have site-based committees, which means you just have one workplace and one committee, terms of reference are not mandatory. However, it is good to have some kind of health and safety agreement to cover things that are not necessarily spelled out in the Act when it comes to the functions and roles of the committee. One of the main duties of a committee is to inspect the workplace. So every workplace shall be inspected by a designated worker member of the committee every month. And if annual inspections are allowed only with ministry approval, and you might have a few terms of reference out there that still say that the workplace can be inspected on an annual basis. However, we want to ensure that the workplace is at least inspected once a month. The Act says a physical condition of the workplace will be inspected. However, there is nothing preventing the member who's doing the inspection from talking with workers and thumbing through health and safety related documents like safety data sheets. And you can even look on the Health and Safety Board to ensure that all the prescribed material is there. So just don't look at necessarily the physical condition, because going forward with COVID-19, we're dealing with something that we cannot see. The hazard really isn't visible. However, if we observe the way workers work, if we observe processes and how workers work, we're going to be able to better to identify whether or not there are recommendations that need to be made or improvements. The third bullet point says that a management representative of the committee may accompany the worker representative during the inspection. However, the inspection is the worker's inspection. So if your agreement or your terms of reference say that a management representative shall accompany the worker during the inspection, that is okay as long as they're affording cooperation and assistance to you. Earlier, Felicia mentioned that the employer is supposed to afford cooperation and assistance to the committee. Well, if they are there to supplement and to aid in your inspection, that's a good thing. However, if they're going to argue with you as to what a hazard is or don't write things down on the inspection form, that is creating a hindrance, and we don't want that hindrance to be there. Meetings. So the committee must meet at least quarterly or every 3 months. And meetings have no fixed time limit. You might have terms of reference that probably say that you meet every month, and that's good because the Act is a minimum standard. We always want to rise above whatever that minimum standard is. But say that you do meet every 3 months, and that the the employer says, oh, our meeting's only going to be for 2 hours long and that's it, and then we'll meet in another 3 months. Well, that is not appropriate thing to say, because whatever you set up as an agenda for the meeting should be captured. We should go through the entire agenda and not say, oh, we have to finish this meeting within 3 hours, because the whole intention is for a committee to have that ongoing dialogue and discussion and try to arrive at consensus at things rather than being pressured to a certain time limit. So if there is a time limit that says that it is 3 hours and you don't get through the agenda, I would be asking, well, when are we going to reconvene to discuss the rest of the things that are on the agenda? Because if you don't get through your agenda, then as far as I'm concerned, the meeting really hasn't finished or taken place. Quorum is established by the terms of reference or a health and safety agreement, and it basically will speak either through your collective agreement or the terms of reference will say what is the composition and structure of your committee and if you will achieve quorum, but the Act doesn't really speak to it. But the Act does say that at no time will the number of management representatives exceed the number of worker representatives. That's always important to bear in mind. Minutes must be taken and conserved for an inspector's review. And voting is not recommended because issues should be resolved through consensus. And if you have in your terms of reference or agreement that you're going to have voting, that's fine. However, we would rather have the committee really discuss matters and to come to a consensus as to how to go forward instead of just leaving things to the vote, because just voting might, doesn't speak to that joint aspect of of a joint health and safety committee. Every committee shall have 2 co-chairs, 1 co-chair from management selected by management, and 1 co-chair from workers selected by the workers on the committee. Even though it's not spelled out in the Act, the co-chair duties include chairing meetings and alternates, prepare the agenda, sign the minutes of the meeting, approve guests to attend the meetings. And either co-chair has the power to put forth a recommendation if the committee has, in good faith, failed to achieve consensus on a recommendation. So if you're in your meeting and you're having a situation where the employer side or management side is just not hearing or doesn't believe your side of the argument, you've had good discussion about it, and you still want to put forth a recommendation, well, the employer can't stop you from putting forth a recommendation. If the co-chair, the worker co-chair says, we should put forth a recommendation and the other co-chair does not agree, the other co-chair can put forth that recommendation. So let's talk a little bit about recommendations. A joint health and safety committee or the health and safety representative has the power to put forth recommendations to the employer, and an employer who receives a recommendation has 21 days to respond. The response must include a timetable to implement the recommendation, or if it's refused, an explanation justifying the rejection of the recommendation. This is very important because we really get a sense of what the employer, if they're going to put stuff forward, if they're going to really listen to the committee, because if it's put forth in a joint manner, the employer should at least consider it and realize that the committee has made that effort to really analyze the situation and that this will in turn promote worker health and safety. And as discussed in the previous slide, either co-chair has the power to put forth a recommendation unilaterally if, having brought the topic to the committee in good faith, failed to achieve consensus. So those are just some of the things to keep in mind as you go forward with your committee. And when it comes to COVID-19, if you're not having regular meetings of the committee, then that's a bit of an issue, because as we know, we're entering into unprecedented times. And it's going to need, the committee is going to be greatly needed, especially at this time, to really analyze and find out, obtain information to really analyze and find out if whatever is in place is truly protecting workers. And we're going to get into that a little bit later when we talk about hazard control. Obstruction of the committee. This is important to remember. No person shall hinder, impede, or interfere a committee member in the exercise of a power or performance of a duty under the Act. And no person shall provide false information to a committee member in the exercise of a power or performance of a duty under the Act. You can find this in section 62. This is important because we want the committee to be able to function without any kind of outside influence, or to make sure that when they actually are analyzing a situation, that they're given all the information in that the information is not tainted or skewed or false to begin with. So that this is something really important, that the committee must be free from any kind of undue influence. So now we're going to talk, we've heard a little bit about duties and functions so far, and we're just going to talk around the general realities around due diligence and what that looks like. So I'm going to turn it back over to Felicia.
Thanks, Paul. So due diligence. We're going to start off by talking about the General Duty Clause 25(2)(h). So the General Duty Clause can be applied where no regulation exists, but the reasonable care to protect a worker does exist. And it's really important for you folks to hold on to that and remember that and apply it in the various ways and powers and functions that you can that Paul just reviewed. For example, if ergonomic-related injuries are a leading case of WSIB claims, releasing cause, of WSIB claims, and there is no current legislation or regulation that enforces the employer's responsibility to ensure an ergonomically safe workstation, then the MOL has adopted standards from Canada and the USA to ensure the impact of those tasks and load on the human body. However, those standards are merely guidelines. However, and keeping in that mind, guidelines cannot be enforced. However, inspectors can write orders under Section 25(2)(h), the General Duty Clause, and that's why we really want you folks to really understand and use this piece of this clause that's within legislation to make your arguments and to look at it from this type of view, that the General Duty Clause is a broad responsibility of employers and supervisors to ensure the health and safety of a worker, as well as other workers at or near the workplace that can be impacted by the employer's operation. In Ontario, the clause 25(2)(h) reads, an employer shall take every precautionary reasonable in the circumstances to protect the worker. And similarly, in 25(2)(c), it reads the exact same for the supervisor as well. When we are looking at the General Duty Clause and when we want to make sure that the employer has turned their mind to every reasonable precaution, we need to make sure that they're allowing you folks, as Paul said, to provide you with information in order for you folks to do a proper assessment and for you folks to use the powers that you are able to, like written recommendations to say such, or calling in the inspector to say they haven't met their General Duty Clause, right? Where an if they haven't, or where an if there isn't something that isn't legislated or regulated. You will see, and you probably have seen, there's lots of guidelines around COVID-19 that's come out. QB has put out a lot of Q&As and fact sheets that we're pushing, and really trying to rely on this clause to make your arguments will be able to help you, because the General Duty Clause is not to be looked at narrowly but broadly. Due diligence means that the employer or the supervisor has to take every reasonable precaution in the circumstance to avoid both harm and offense against the Occupational Health and Safety Act and the regulations. The exercise of due diligence should not be done before, the exercise of due diligence should be done before anything happens. So being proactive, not reactive, right? And it cannot be considered due diligence if the health and safety measures are implemented after the accident, incident, injury, or occupational illness has occurred. Telling the workers to act safe in the workplace will not keep workers free from harm if the hazard still exists. Workers, as we know, and as we're all humans, can make mistakes, and we do make mistakes. But if the proper controls are in place, the impact to exposure to the hazard, injury, or illness will be less serious. And to ensure the compliance with 25(2)(h), all hazard and risks of the work must be identified, assessed, and controlled, right? And we've looked, and we will later on in the webinar, go through some principles and, as Paul mentioned, hierarchies of control on how to do that to ensure that the employer is compliant, and for you folks to be able to look at hazards from that lens in order to ensure that they've met their obligations. The precautionary principle. So the precautionary principle means to taking prudent action in the face of potentially serious without waiting for completion of further scientific research. So looking at best practices and implementing those things prior to waiting to see what stats, data, and scientific research comes back to say, or waiting until somebody gets ill, dies, or an incident or accident occurs. And the point, and this is a quote that came out back in 2003 from the SARS Commission, specifically by Campbell, and we just wanted to read it to you folks so you folks can kind of look and reflect on it in today's age. The point is not who's right and who is wrong about airborne transmission. The point is science, but not science, but safety. Scientific knowledge changes constantly. When it comes to the worker safety in the hospital, we should not be driven by scientific dogma of yesterday or even scientific dogma of today. We should be driven by the precautionary principle that reasonable steps to reduce risk should not await scientific certainty. Until the precautionary principle is fully realized, mandated, and enforced in Ontario's hospital, workers will continue to be at risk. This is really important for you folks to really turn your minds and think of, especially those of you folks that are going back into reopen workplaces or planning for that, is not to wait until folks become ill and are exposed to COVID-19 because of the lack of controls, the lack of time to try and identify and assess the workplace, the time to sit down to meet as an employer and as a committee, or as a health and safety representative and the employer, to really turn your mind to what is that plan going to look like and what measures are we going to put in place and what things you folks can suggest to put those measures in place in order to protect the workers when they do return to work or as they continue to work through this time now. So now we're going to get a bit more specific into what me and Paul have been touching upon and talking about hierarchies of control, the race principle, and controlling hazards. So over to you, Paul.
Thanks, Felicia. So I've been saying for the last few months is that we need to just think of COVID-19 as a hazard like any other hazard in the workplace. And any hazard in the workplace can be assessed and controlled. Now, when it comes to controlling the hazard of COVID-19, it's a little bit more complex because we're dealing with a highly infectious disease. However, if we just go through the process of assessment, we should be able to put in place overlapping mechanisms to ensure that the things that are in place are overlapping to prevent workers from eventually getting exposed to COVID-19. So what is a hazard? We have to consider that a hazard is any source of potential damage, harm, or adverse health effects on something or someone. And hazards exist in our workplace, and it's up to the employer, as we've learned, to use the precautionary principle to take every precaution reasonable to ensure that the hazards are not exposed to workers. So to effectively control a hazard, it is important to understand the hazard, and the most common way is through a hazard assessment using the RACE principle, R-A-C-E. So R stands for recognize, then A stands for assess, C is for control, and E is for evaluate. When we talk about recognize, we're asking ourselves to identify the hazards in the workplace. And generally how we do that is through inspections. We can do it through surveys, hazard mapping, body mapping, accident reports. If you have near-miss reports in your workplace, that's a way of identifying a hazard. Test results, exposure rates, and also we can recognize hazards just by observing the workers and their work. The next step is to assess the hazard. What we mean by assess, this is the most important part of it. This is one of the more important parts of the principle, is to learn everything about the hazard. You want to learn about the hazard's source, if there's any training required for the hazard, is there any policies, procedures, what does the current regulations say about the hazard? What are the current guidelines? What are the best practices? How does the hazard affect workers in the workplace? And ensure that we have to also determine who are the employees that are going to be affected by exposure to a hazard and at what level. Then we get around to control. And when it comes to control, it's applying the hierarchy of control. And these are terms that you've probably heard before, is that we can control the hazard at the source. And if we can't eliminate it, we can then look at trying to control the hazard along the path. And finally, at the end is PPE, which is controls at the worker. Once we've applied the most appropriate control that's going to adequately protect workers, controls that are going to adequately protect workers, then we have to evaluate to determine, did we put whatever we put in place or whatever we recommended to put in place, is it continuing to protect workers? And then you have to start over again and recognize by looking at, exposure rates, illness reports, worker complaints, to determine whether or not whatever is put in place is actually protecting workers. So in general, when is a hazard assessment required? It's usually required before any new workplace policies, programs, processes, or activities are introduced. So with COVID-19, we definitely know that there are new policies and programs and processes put in place. It should also be done before changes are introduced to existing policies, programs, processes, or activities, including when products, machinery, tools, or equipment change. And I'm sure if you have a pandemic plan, your employer has a pandemic plan, I'm sure it's been reviewed multiple times. We have to ensure that whatever is put in place, that the committee does a gap analysis to determine if we've captured and that we've left no other worker exposed. When hazards are identified or new information becomes available about existing hazards. So going forward, as we learn more about COVID-19, we're going to have to ensure that we're instituting, we're taking that new information and that assessment and putting in proper controls as we learn new information. And where is a hazard assessment required? It's required where the worker is likely to be exposed to the hazard and where the exposure is likely to cause injury or illness. So here's the hierarchy of controls. This is C for control. So all occupational health and safety hazards can be controlled using the hierarchy of control. The most effective way to control a hazard is at the source through elimination or substitution. If it is impossible to control the hazard at the source, the next step is along the path using engineering and administrative controls. And the next step is at workers using personal protective equipment. And this is the least desirable manner to control the hazards. And when it comes, we're going to go through the RACE principle a little bit later. We want you just to, as a kind of a preview, I want you to remember that a lot of the discussions lately have been around PPE. And as you will note on the diagram, is that PPE is the least effective means of control. So we really need to start looking at what are the engineering controls, what are the administrative controls that can be put in place so that we don't just have to rely on PPE. Even if we were not sure or we disagree with the employer as to what appropriate PPE is, while we have that debate, let's ensure that we're putting in robust engineering and administrative controls. And this is when it comes to you as Joint Health and Safety Committee members to really be creative on how we're going to protect workers. And as you've seen in the last couple of months, if you've been out to the grocery store or to a bank or just maybe it's already been instituted in your workplace, things like physical distancing, barriers, processes, screening, self-assessments. These are all, like I said earlier, overlapping controls that have to be in place so that workers do not get exposed to COVID-19. So we're going to go through the process starting with R for recognize, and I'm just going to turn over to Felicia. So we're going to apply the hierarchy of controls in political and public sector workplaces in relation to COVID-19. Go ahead, Felicia.
So we need to identify what are the hazards of COVID-19 and where there is a risk of exposure. So really looking at the work that you folks do, what type of work you do. Do you have direct contact with public or patrons or children, depending on your various workplaces? Really being able to understand how COVID-19 is transmitted, what type of biological illness is it, and really being able to identify those pieces. Monthly inspections, surveys, floor plans, exposure reports, accidents and illness notices, really taking your time to look through all of these various things, right? You could be surveying if the workplace is open or even not. I'm surveying certain types of questions that will help you to recognize the type of work that all of the members are doing within the workplace, right? Looking at floor plans to see the entrances and exits of where people may come in and out of, where all the washrooms are, where the staff washrooms are. Is there a difference between public and staff washrooms? Where are people's offices located? What is the traffic around those offices would be, or offices or work sites would be? Looking at exposure reports if you are open to see where is that exposure happening, and then accidents and illness notices as we've mentioned earlier, looking at that and being able to extract that information again to try and pinpoint where those occurrences are happening, to then further down the line look at it to assess it. So you want to identify workers and the task where is likely to expose those workers to COVID-19. Okay, and that could be done with using the floor plans as well, potentially using surveys if there's information that you folks don't know that you need to collect. Looking at monthly inspections, previous ones may be helpful for you folks to see if you have dealt with previous biological hazards in your workplace, and seeing maybe what has been done then as well would be helpful. Assess, and as Paul said, the assessment piece is very, very important in the RACE principle, so you do want to take your time with it, right, and making sure that you assess everything that's afforded to you and available to you. So you want to review new or existing policies, protocols, and training programs that are related to IPAC. Pandemic plans, very, very important. Are they getting updated? Is there one? If there isn't one as you're going back into work, what is that going to look like? And is it going to protect workers? And updates should be ongoing. As Paul said, with the RACE principles, when you get to the end of the evaluate, sometimes there's missing pieces or missing gaps. So you may need to go back and recognize and do the assessment piece again and go back through it. Infection control plans. Have they been updated to reflect COVID-19? Do you even have infection control shots? I'm assuming most of you do, as you should. But really going and looking at what does that look like from a COVID-19's perspective, and trying not to completely reinvent the wheel, right? But relying on other biological hazards that's presented themselves in the workplace, and what were some best practices, things that we did then that we could potentially adapt and maybe slightly modify for COVID-19, or what are gaps within that infection control plan that didn't work last time that we need to revise and put in other types of controls, which is the next letter that we get to, in order to protect the workers. Measures and procedures to protect workers from exposure to COVID-19. So really looking through the type of work you do, how the work is being done, where the work is being done, and putting in those measures and procedures in order to modify them to reduce the exposure to COVID-19. Right, so if that means, for example, in libraries, if you typically are sharing bathrooms with the patrons, and as you're reopening, there might have to be a schedule to which you would use particular washrooms, or you would completely isolate the worker's washroom from everyone else in order to reduce that exposure. So that might be a measure that's put in place, right? Training. All the workers should be familiar with the routine practices and additional precautions in order to avoid COVID-19. As we said, these are unprecedented times, right? So it's not to say that we already have these precautions. Maybe there's additional ones aside from COVID-19, aside from what we've had that we need to include to avoid that exposure to COVID-19 that wasn't considered before. If you're not familiar with the routine practices, then that training needs to happen. There might be shortages in your workplaces, so you might have to be reassigned to do temporary duties to making sure that that training piece is happening as well. Personal protective equipment. Is it required? Is the fit testing required? Reviewing training records and supplies for it, right? Really important that if an employer is going to result to the last piece of the control mechanism, right, as Paul said, PPE is our last resort and the least effective. Not to say that you can't rely on it, you can't use it, but we don't want you to rely on it. We want you to use the other substitution and engineering and administrative controls first. But if so, is there training for donning and doffing so that you're not going to still transmit transmit the hazard, right? Do people understand what does good condition PPE look like and what does that mean? Is it fitting properly? Because if it's not fitting properly, it's not going to protect you, right? So really turning your minds to all of those things. And legislation. What does the Act and regulations say? We've gone through some really key pieces of the Act and some regulations that you folks will be able to rely on in your assessment. But how do we achieve compliance of those clauses that we went through today? And also looking at other guidelines, maybe not legislation, but other guidelines and best practices that you folks have seen out there or are recommended by us to use in a part of that assessment piece. And now Paul's going to go through the last two letters for us.
So we're at control now, and we learned earlier that elimination is the number one thing that we have to ask ourselves. Can we eliminate the hazard of COVID-19? And that question is really, it's kind of difficult to answer because sorry, excuse me, I'm just going to pause for a second. Sorry about that. We have to ask ourselves, is eliminating COVID-19 possible? And there is ways of eliminating COVID-19, and that is identifying workers that can still work from home. So if you're at home, you're eliminating the chances of you being exposed to COVID-19 rather than being at work. So that is a form of looking at elimination. So it is important for the employer to continue to identify if workers are essential to the workplace. Are they required to be at the workplace? You can, in terms of substitution, it's not as if we're talking about substituting COVID-19 for something else. In this application, we're asking ourselves, can dangerous products like biological, chemical products that are used in the workplace be substituted for products that do not create a hazard? So if part of your IPAC or your measures and procedures to control COVID-19 in the workplace involve disinfecting or frequent disinfecting, what is the product that you're using? Are you using bleach? Because that is pretty caustic. It's very corrosive to both materials and to humans. So can we look at other products that effectively kill the SARS-CoV-2 virus? Can we look at just substituting whatever currently is in place for a less harsh chemical? So that's what we kind of mean by substitution for COVID-19. So let's look at engineering controls. And we talk about engineering controls, we're talking about isolating the hazard or designing equipment and processes to reduce the source of exposure. Those things could include physical barriers, machinery guards, equipment design. Look at what you need to use in your workplace. If you're required to use equipment Are you sharing the same equipment? Maybe it's better to have equipment assigned just to one person. Ventilation. Ensure that your workplace has good either general, local, or natural ventilation. That is one thing that is key to reviews have been looking at is the spread of the virus. And in situations where there is no ventilation, the virus is able to stay airborne in certain circumstances for a long time when there is no ventilation. Screening clients, patients, students, whatever you deal with in your workplace before entry to the workplace is a process to ensure that if people are required to access the workplace, they've at least gone through a screening process, and to ensure that whatever screening process is in place is effectively preventing someone who is a potential case or suspected case of COVID-19 from entering the workplace. We need to limit our points of access to our workplace to just one, so that there is no that we can ensure that people that come to the workplace that are required to be there, that are essential and have to be there, that there's one single point of access to the workplace. And if we do treat people who are suspected confirmed cases of COVID-19, to ensure that whatever the job it is that you do, and that's required to be part of your job, is to provide that kind of care, that they are isolated to one area of the workplace, and that they don't, that they are not carrying the virus or doing that viral shedding of the workplace throughout multiple areas of the workplace. So administrative controls are next, and this is changing the way people work. This is a very broad scope of controls. So whatever training you're receiving, you need to look at that and see if it's effectively, are workers aware of what they need to do to prevent exposure? Are they aware of all the policies and programs and your quote unquote standard operating procedures that might exist? Are they aware of them? Are they meeting the task of are workers familiar with them, and are they actually providing the necessary information that workers can just go forth and take care of themselves in the workplace? Self-monitoring is important as we go forward in the era of COVID-19, and we mean self-monitoring is we're self-monitoring for symptoms to ensure that if we're unaware, because of the asymptomatic nature of the virus, we have to ensure that those who might be experiencing symptoms, that they have a clear process to ensure that they communicate with their employer that they've developed symptoms, and that they should not be accessing the workplace, and to have that communication to a point person for the employer to say that I've developed symptoms, therefore I won't be attending work. You want to look at also, is shift work available? Whatever the job you do, can we have staggered shifts to ensure that there's not so many people in the workplace, so that we can enforce that social or physical distancing? And within the workplace, you can have things like staggered break times to ensure that there's not a congregation of people, all that are in the same break room at the same time. And of course, we have to look at hand hygiene, the cough etiquette, and washrooms for staff only are other ideas. And going forward, I invite just to really think about whatever processes can be placed in your workplace to prevent that exposure, to be creative about it, and not to just accept that whatever is in place is automatically going to protect workers. And PPE, we're just going to cover this briefly, is the last resort. And PPE should only be used when the hazard can't be eliminated or completely controlled by engineering and administrative controls. If you're going to be wearing PPE, you have to be trained on its use and its cares, and what the limitations are and how to remove or put on safely. And the PPE should be stored in a clean and a convenient location, and it should not create other hazards like discomfort or heat. And after we're all done, we have to evaluate to ensure that the controls adequately protect workers. So we've included some resources here, and we're not going to go through them all. This presentation will be posted on the CUPE Ontario website. And when you have a chance, these are just important resources that, as members of the Joint Health and Safety Committee, you can use going forward, and some good agencies, health and safety agencies, that'll help you try to navigate and instill the best practices possible going forward to prevent workers from exposure. So we will take some questions. I've seen a few have already popped up in the chat bar. And just a reminder that we'll just deal with the general sector. And if you have workplace-specific issues, you can bring that up either to your national representative or your local executive might be able to assist you in those particular questions.
Okay, so we have, our first question is, do they have to provide violence risk assessments to the employees or only the committee?
So under Section 32.0.1, the employer is required to provide a violence risk assessment to the committee. There is a clause in Section 25.2M that says that if the employer has a report and that report respects occupational health and safety, the employer is required to share that report with a worker, the results of the report with the worker. So if you could use 25.2M as maybe a way to say to the employer, as a worker, I would like to see your risk assessment, I agree that it should be shared. There's nothing in there that is harmful for the employer. There's nothing there about privacy or confidentiality. The results of a risk assessment really just will help identify where the risks are for workplace violence in the workplace. And if you are to do a risk assessment for COVID-19, we are strongly recommending that employers do that risk assessment with members of the Joint Health and Safety Committee. It is the employer's responsibility to assess the risks of exposure to COVID-19, but we want to ensure what is that risk assessment going to look like, and can the Joint Health and Safety Committee be involved in that risk assessment so that they can be part of it and ensure that it's done effectively and it's covering all the necessary steps.
And I will also just add, for the assessment of the risk of violence under 3203, it outlines there what the assessment shall take into account, and further talks about the results that the employer shall provide too. Okay, so next question. If the municipality has created a task team to create a plan for the return to work, does the Health and Safety Committee need to review the plan prior to the employees returning?
Go for it, Felicia.
I would say that should be the Health and Safety Committee. Maybe if it's not feasible for the entire Health and Safety Working Committee to be on it, then maybe part and parcel. I know also you may want to look at the terms of reference. I know some terms of reference do speak to ad hoc committees or specialty committees that can be formed that aren't a part of the Health and Safety Committee, but kind of like an extension of them. However, I would still strongly encourage that the Health and Safety Committee would need to review, because they would need to be consulted on occupational and safety policies, as we highlighted earlier.
Yeah, there's nothing like it's hard to point to a certain provision in the Act that says, yes, Joint Health and Safety have to be involved in this kind of plan or assessment. It's implied. It's implied in the sense that under 918 is that the employer just has to provide you with information related to occupational health and safety, and instead of having a reactive, being reactive mode to whatever the employer is going to put in plans, we'd want the committee is best placed for this kind of situation. They are the ones, I would think, would be the experts to really evaluate, to ensure that there's been a proper assessment, that the proper controls are in place. How you go about doing that is I would write to the employer as a committee. I would get some kind of joint agreement with the committee to say that we should be involved, and that before workers enter the workplace, we want to have our opportunity to do our functions and to ensure that the internal responsibility system is met, for us to identify the hazards, obtain information and make recommendations.
Yeah, because as Paul said, the IRS, I think that can definitely be pushed because as Paul identified earlier, a good component of that and a key component of that is it a functioning committee, and that's for you folks to be able to identify hazards and make recommendations, right, with the goal of preventing accidents, injuries, and lost time. So I think that's a great way to insert yourself that way. Okay. Can an employee still wear masks and gloves even if the employer feels it's not necessary?
It sounds like the email conversation we were having earlier today, Felicia.
I know.
Okay, so we're just going to say this, is that if there is a risk of exposure to COVID-19, if there is a likely exposure that can happen, that means if you're meeting members of the public who haven't been screened, or you're working in such a manner that you can't ensure physical distancing with your coworkers, or if there's no barriers in place, those are situations where the employer would likely have to provide you personal protective equipment. So if you feel the need that you have to wear a mask and gloves to protect yourself in the workplace, I would address it with your Joint Health and Safety Committee or the supervisor to say, what are the protections that you're going to put in place for me to protect myself? And that's what I'm saying is in general, we don't want the workers taking ownership of the protection on themselves. We want to make sure the employer is doing every precaution reasonable to ensure that you have the proper protection in place. So look at the engineering controls, look at the administrative controls, and if still you feel as if there is a necessity for PPE, have the committee look at it and to determine whether or not it's appropriate in the circumstance, because we don't want the PPE itself to be considered a hazard. And wearing a face mask or a homemade mask is basically just to protect yourself from giving it to someone else. One of our colleagues has described wearing a face cloth as
Kleenex,
as like wearing a Kleenex over your face, or the equivalency of sneezing into your arm.
Yeah.
So it is not depending on the type of PPE, sometimes you have to really look and ask yourself, why is this necessary and why isn't the employer providing it?
Great. Okay, our next question. Can you confirm that I understood correctly that the Health and Safety Committee should be meeting more frequently during this COVID pandemic? If so, how often should they meet? So I think when Paul was talking about this, actually, Paul, do you want to answer because you were talking about the committee meeting?
Yeah, what I meant was, like, these are unprecedented times, and if there ever was the need for Joint Health and Safety Committees, it is now. And if you're meeting every 3 months, I don't think that's acceptable right now. Just knowing, I don't know where you work, and I don't know what kind of workplace you have, but we talked about the internal responsibility system. Is that the key to that is to have a joint committee that is constantly looking at what is happening in the workplace to ensure that workers are protected from COVID-19. So there is no number. I can't toss out a number for you to say you should meet every 2 weeks or every 4 weeks. I don't know what your workplace looks like, but if you are noticing that, the workers are putting in complaints that they don't feel safe, that they don't feel protected in the workplace, well, the committee should be meeting more often to make sure that things are put in place, or that. So it's really hard for me to really put a number down, but there's nothing wrong with requesting special meetings or standing meetings of the committee going forward. And whatever you feel that is necessary in the workplace, I would push for as many meetings as you can get to ensure you're having that ongoing dialogue with the employer.
Yeah. Great. So I think the other question was answered as what was IPAC? Sorry, it's infection.
Yeah, this PowerPoint presentation was it's the same PowerPoint presentation for all the sectors that we're doing.
Yeah.
So when we talk about maybe your workplace never had an infection prevention control plan to begin with.
Yeah.
Well, I think now is time to get one up. If you are required to meet, if you have run-ins with clients or members of the public or citizens, whatever have you, what is the employer planning on doing when it comes to preventing infectious diseases from impacting the workers? And really reviewing the pandemic plan, making sure that if PPE is required, that there's appropriate stock of PPE for all workplaces. This is a time when you're going to have to ask your employer for a lot of information.
Yeah.
And we talked earlier about the general duty clause, take every precaution reasonable. Well, this is time for them to work arm in arm with the Joint Health and Safety Committee and ensure that every precaution is taken and that you're given the chance to make those recommendations with all the best information that's out there.
Mm-hmm. Okay, no more questions?
Okay.
I'll give a couple seconds. No?
It's been...
Okay.
So I would say just review our the attachments that came with the email blast for this webinar. Read those cheat sheets. There's a sample recommendation that is on there that you can use if you've never put forth a recommendation. And we want to thank you for participating today. And hopefully going forward, I wish you all the great success, and I pray that you stay safe. Thank you very much.
Thank you.